Hello, good evening. My name is Argelia Elenes, and this video is an educational / informative video on how to obtain an informed consent when obtaining or when wanting to do a blood transfusion to a patient. So, I decided to do more like an informational video rather than a skit. So here we go. So the first thing you're going to want to do when obtaining informed consent is to verify you have the right patient, that you're speaking to the right patient. So you're going to want to verify their name, date of birth, all that good stuff. Once you have verified your patient, you're going to want to make sure that you're in an adequate place where you have enough privacy, if not already in the patient's private room, because some personal information such as religious preferences, as well as maybe diagnosis, may be brought up in the conversation. So you just want to make sure that you're providing privacy for your patient. That may also allow them to feel more comfortable asking questions, discussing what the topic at hand. So now that you have verified that you're speaking with the right patient and that you're in a proper environment, you'll want to explain to your patient that consent is required for the treatment of blood transfusion. I would say something along the lines like, this is my informed consent. I would say something along the lines of, this form here is an informed consent form. This form explains the purpose of the blood transfusion, the risk associated with the procedure, the available alternatives, and here at the very bottom it asks for your signature to confirm that you understand and consent to a blood transfusion. Although your doctor has gone over this information with you, I want to know if you have any questions. If the patient has questions, as their nurse, we can answer their questions, but if they are seeming like they don't understand the purpose or why they're getting the transfusion or how it works, we must call their doctor and ask them to review the information with them. If the patient does not have any questions and states they are confident in their decision, we can go ahead and give them the form for them to sign and start to prepare for the next steps, which would be to obtain a screen cross match. It might also be a good idea to go ahead and confirm with them what their religious preference is. Sometimes, like Jehovah's Witness, don't receive blood transfusions. It's a conflict with their religion, so you want to make sure that that's in the clear. Also, reiterate the fact that they're receiving blood products. Make sure that they know that's essentially what this is. Other things too is other things to keep in mind while you're doing the informed consent would be use simple terms. Don't walk in the room and say like, hey, your CBC, this and that. Like, you're gonna want to use like terms like, your blood test is showing us X, Y, and Z, and that's why we have to do a blood transfusion. So you're gonna want to use very simple terms that they can understand. Make sure you're giving them time, speaking in at a good pace, and you're not just throwing information at them. You might even want to start the conversation if they do have questions like, what do you know about it? Like, tell me what you know, tell me what you're unsure of, and have like a good discussion with them about what it is, and that way you get to gauge their knowledge and how they feel about it. So that's my informed consent video. I hope that this was very on point. I hope I didn't miss anything.